Hi, Violet.
Hi.
How are you today?
Good. How are you?
I'm Liz Westberg. I'm fine. Thanks for asking. I'm Liz Westberg. I'm going to do your assessment today. Okay. Could you give me your full name and date of birth, please?
My full name is Violet Diane Westberg, and my date of birth is 5/08.
That would make you 12. And in what grade?
7.
Awesome. Were they nice to you when you came into the office today?
Yes.
Did they check your vision
Yes.
using the Snellen test?
Yes.
That's testing for cranial nerve too. And did they do your vital signs?
Yes.
Awesome. Sounds like you're all set to go. I'm just going to ask you 3 questions before we get started.
Okay.
Do you know what year it is?
Yes. 2020.
Awesome. Do you know what the date is?
Yes. October 7th.
Wonderful. And do you know where you are?
Yes. Intermed.
Awesome. All right. I'm going to wash my hands and we'll get started. First, I'm going to look at your head, your face, and your neck. Okay. Everything looks good, all intact, no issues, no rashes, nothing jumping out at me. Do you have any issues to tell me about?
No.
Do you mind if I touch your scalp?
No.
Okay, I'm going to just look through. Everything looks good. No redness, no itching. Correct. Okay, any tenderness on your face?
No.
Okay, I'm going to palpate your sinuses, your frontal sinuses. Any tenderness? No. No. Any tenderness here?
No.
Your maxillary sinuses. Wonderful. Let me look at your neck. It's beautifully symmetrical. And I'm going to feel your carotid pulse, palpable. Other, palpable. I'm going to palpate your thyroid. I feel your cricoid cartilage. I'm going to have you take a sip of water. And hold on. Do you mind if I touch your neck from behind you? No. You're going to feel me pushing on one side of your throat and palpating with the other. Go ahead and take a sip. Thyroid is palpable. And are you no enlargements noted, no nodes noted. Okay. I'm going to listen to your pulses. First, I forgot to check your temporal mandibular joint. So I'm going to have you open and close your mouth. And then move open again and move your jaw from side to side. No crepitus, no clicking, no tenderness. Wonderful. Okay. I'm just going to listen to those pulses that I felt before. And then I'm going to have you lay on the table. No bruising noted. I'll have you lay on the table. Wonderful. And then we're going to check for JVD. Going to have to lay down at a 30 to 45 degree angle. Look out that window. No JVD noted. Very nice. Going to check the other side. And no JVD is noted. Very nice. Thank you, Violet. Okay. And now I think what I'm going to do is check for range of motion in your neck. Can you look down and up for me? Wonderful. Can you look side to side for me? Good. No pain on that. Okay. Now I'm going to palpate your lymph nodes.
Okay.
Okay. You're going to feel me just gently massaging the lymph nodes, pre-auricular, post-auricular, cervical, tonsillar, submental, submandibular, supracervical, deep cervical, posterior cervical, and submandibular. Excellent. No palpable lymph nodes. Great. Okay, that's a good sign. Now I'm going to take a peek at your eyes. I'm going to have you look up. Beautiful. No issues with your eyes. No itching, watering, burning. Okay. I'm going to get my light and test your reflexes. I'm going to test for a direct reflex, a consensual reflex, and for accommodation. Okay. See me shine. Direct reflex is present in both eyes. Consensual reflex is present in both eyes. I'm going to use this object. Look at this object for me. Now look past it, please, and back to it. And accommodation is present. And now I'm going to have you follow my object here. Wonderful. We're testing for cranial nerve 3, cranial nerve 4, and cranial nerve 6. We're testing for ocular motor, trochlear, and abducens. And now we're going and doing that with the 6 cardinal movements. Now we're going to check for convergence. I'm going to follow this object into your nose. Very good. And now I'm going to check for confrontation. You know this? Tell me when you see me wiggling. See? 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 Excellent, Violet. Thank you. Okay. Now I'm going to check your eyes with my scope. We're checking for the red reflex, the optic nerve, and we do not want to know any AV nicking. So I'm going to come in here. I'm going to touch your forehead. Oh, red reflex is present right away. Optic nerve is visualized, and there is no presence of AV nicking. I'm going to check the other side. Yeah, red reflex, optic nerve visualized, and no presence of AV nicking. Okay, wonderful. Okay, now I'm going to take a look at your nose. First thing I'm going to do is switch the tip of this because we just looked in your ear. They don't know that. So I'm going to take a look at your nose. I'm just going to palpate around a little bit. Okay. No issues here. Everything's soft. Okay. And I'm just going to test your breathing. Can you occlude one nostril and breathe in, and occlude the other and breathe in? Very good. And testing for cranial nerve number 1, just a sniff of eucalyptus. You know what eucalyptus is supposed to smell like? Mm-hmm. You yes. Smell it? Strong, right? All right, now I'm going to take a peek inside. Note any deviation. Look on the other side. No issues there, no deviation. And nasal patency is good. Okay, so now we're going to do the ears. Any issues with your ears that you can tell me about? All set. Okay, I'm going to just take a peek at the outside of the ear first. Then I'm going to look at the inside of the ear, and I'm looking to visualize the cone of light, the handle of malleus, the eardrum, and some earwax, hopefully. Okay. Maybe not too much, right? Mm-hmm. Do you feel like I know you're a swimmer, have you felt like you've had a lot of wax lately in your ear? Not much. No? You have to go in a little bit further for this. There's a lot of wax on this side. Oh, but I do see your eardrum, and I do see the cone of light and the handle of malleus. I'm slowly extracting to visualize all of that. Good. Sit up straight, please. Okay. I'm going to go into this one. Pull up a little bit on Violet's ear to see, but I can see the eardrum, the cone of light, and the malleus. And I'm going to slowly remove, and there is a normal amount of wax. And I'm just going to test your hearing now by whispering a few numbers in your ear, numbers or letters in your ear. I'll have you cover up one side of your, Thank you. Okay. 3, 2, 1. And let's cover up the other side. 2, 5, 6. Excellent, Violet. Be right with you, Violet. Awesome. Okay, so that is testing the acoustic cranial nerve number 8. Now we're going to move on to the mouth. Okay. Speeding right through. Okay, I'm just first going to change the light on this. Open your mouth for me. I'm just going to take a peek at all the things. Oh, look at that. Looking at the tongue, the soft and the hard palate, the teeth, the cheeks. Have you underneath of your tongue. Excellent. Looks good. And now I'm going to have you, I'm going to press down on your tongue with the tongue depressor. I'm going to have you open up and say ah. I need you to open your mouth. Yawn, yep. Stick your tongue out. Say ah. Excellent. Uvula is not deviated. Throat is even. And saying ah, this is testing cranial nerve number 9 and cranial nerve number 10. 9 is the glossopharyngeal, 10 is the vagus. And now I'm going to have you stick up your tongue, move it side to side for me. Good, that's testing cranial nerve 12, hypoglossal. Have you clenched your teeth? Great, now we're going to test sharp or dull. I'm going to use a Q-tip here. The softer side of the Q-tip is the dull, and this side is the sharp. I'll let you feel it. Okay, have you close your eyes? Just respond when you feel it, and if the touch is sharp or dull.
Sharp. 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 Dull. Dull. Sharp. Dull.
Very good. Okay, so that's testing the facial cranial nerve number 7. And now we're going to move on to, I will have you puff out your cheeks. And now you can look good. And I'm going to close, squint your eyes and try to open them against resistance. Great, I want you to smile. Show those teeth. Brown. All right, and that's testing the cranial nerve 7. I'm sorry, clenching and sharp dull test cranial nerve 5, trigeminal. Okay, now I'm going to have you shrug your shoulders against resistance. Excellent. I'm going to have you turn your head this way. Nope, to my hand. There you go. And push against resistance. Now, same thing on this side. And push against resistance. Okay, that's testing the spinal nerve, number 11. Okay, so now I'm going to have you do some rapid movements. Fingers, or sorry, hands on your knees. Can you do this for me? Can you do it faster? Awesome, Violet. No issues there. Now I'm going to do reflexes. I'm going to start with the knee. Nice and relaxed. Good. And we're going to go to brachioradialis. That was a little exaggerated. Was it real? Yeah, I'll have to test you for clonus. I'm just kidding. So we'll do brachioradialis. I'm going to hold your thumb. Kind of going out of order this time. That's okay. Relax. Good. Relax, relax. There you go. This will be easier to get. Good. And now I'm going to have you dead arm. Dead hang your arm this way. Good job. Good. All right, and now I'm going to do, I'm sorry, this is the bicep. I guess I didn't say, I just did the tricep reflex. Brachioradialis was first, then tricep. That was bicep. There's that one. Oh, yeah. Excellent. Okay, excellent reflexes there. I think the last two we have to do are Achilles reflex and plantar reflex. Go ahead and have a seat on the table. And for Achilles, we're going to have Violet bend her knee here. And yeah, just fade out. I'm going to dorsiflex her foot, and right above her Achilles, find her reflex, and it's present. Same on this side. Find that reflex and present. And the plantar reflex. Oh yeah, there we go, Violet. And curl it in. Okay. Awesome. And have you pop up, and we're going to check your, oh, actually, I'm going to check, the last thing I'm going to check is have you take your heel and slowly bring it up to your knee and back down. Wonderful. And do the same on the other side and back down. Wonderful. I'm going to have you pop up. I'm just going to watch you walk from the doors to the computer or to the desk. Great. And turn around and yep, let's walk on your heels and on your toes. Good. Right back to me now. We're going to do the Ronberg test. I'm going to have you stand with your hands at your side. Close your eyes. And we would note the patient had any dizziness or syncope or was not able to keep his or her balance. And that's not anything Violet's having right now. Violet, go ahead and open your eyes. Now we're going to check your pronator drift. Have you do the same. Arms out in front. Close those eyes. And she does not have a pronator drift. Wonderful. Well, thank you so much for being such a good patient, Violet. Thank you. I can't think of anything else I want to assess. Is there any questions you have for me or anything else that you'd like me to take a look at? No, I think we're good. I think we're good. Okay. Well, it was my pleasure to meet you, young lady. Good luck.
Thank you.
Thank you. Bye. Bye.